This is Radio Health Journal. I'm Nancy Benson. This week, getting neglected communities to believe in the COVID-19 vaccine.
The trust that has to be built among the Black community has to be built not just through a few people, but through a governmental system.
Building trust where there's reason not to have it when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics, from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
They'll say, I don't remember the eyebrows. Well, that means the eyebrows were boring. That means he didn't have thick, huge, Tom Selleck eyebrows.
The fascinating work of a police sketch artist. Then,
as someone who studies this, I find the rhetoric really quite disturbing. It's just people just tossing around the term treason very casually.
We speak with a legal scholar about the serious capital charge of treason. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station, and subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Vaccines against COVID-19 are rolling out as quickly as officials can get it done. Many people have welcomed what they see as a magic bullet against coronavirus. But its success depends on about 75% of people getting the vaccine. Some groups may not come close. For example, a September survey of Black Americans by the COVID Collaborative showed that fewer than half plan on getting the vaccine. Only 19% think it's effective, and only 14% trust that it's safe. Those numbers don't surprise Dr. Leon McDougall, professor of family medicine at The Ohio State University and president of the National Medical Association, the nation's largest medical organization representing African American physicians.
There is skepticism in regards to whether one should receive the COVID-19 vaccine, and also accompanying that is the fact that Black people are dying at nearly 3 times the rate of European Americans. We are being hospitalized at nearly 4 times the rate of European Americans.
Part of what we're hearing behind those statistics is how much there's really just a bit of skepticism and hesitation, because people still need more information before they're ready to declare readiness to be vaccinated.
That's Dr. Jewel Mullen, Associate Dean for Health Equity at the University of Texas Austin Dell Medical School, and a former acting director of the National Vaccine Program.
As we have seen in other communities across the country, we've seen individuals range from utter concern and thirst for information about everything they can do to protect themselves and their families, to questions about how serious this disease is, what their risks are, and whether or not they can trust the information that they're receiving about how to stay safe.
Among Black Americans, distrust of the medical system runs deep, and with good reason. Medical brutality goes back hundreds of years. Even as late as 1972, the federal government's Tuskegee study systematically denied medical treatment to Black men infected with syphilis. That history is widely known, but Mullen says good information could start to combat distrust and other reasons for avoiding the vaccine.
Even among my Black patients, for something as simple as getting a flu shot, there can be different reasons why people decide that they do or do not want to get it. And sometimes it's not distrust of the science. Sometimes it's not really knowing that vaccine is available to them, where to go, whether or not they can afford it, who's going to pay for it, and that question that so many people have across races and ethnic groups, which is, does the vaccine cause the disease it's trying to prevent? So I do believe that information is part of the answer, but we have to take a step back and not assume what information people need. Maybe it's the trust issues that you're talking about, but maybe it's addressing some of those other concerns that I just mentioned.
National medical leaders know they'll have to go a long way to rebuild trust at a time when they really need it. The federal government's infectious disease expert, Dr. Anthony Fauci, has pointed out that a Black woman, Dr. Kizzmekia Corbett, was instrumental in the vaccine's development. But Mullen says one scientist doesn't erase the distrust of the past.
It might be well-intended to say, look, there was even a Black person involved in the development of this vaccine. That can backfire because, once again, this is not COVID affects the entire U.S. And the trust that has to be built among the Black community has to be built not just in a few people, through a few people, but through a governmental system. And I tell my medical students, learn medicine, but learn medicine in the context of knowing history. For the subset of African Americans who carry distrust because of something like the legacy of Tuskegee, the notion that people should be trustful because African Americans were involved might just give people a chance to say, yes, we've heard that before.
You can expect that messages about the vaccine will be positive. They won't be about what people might lose if they don't get vaccinated, but rather about what they'll gain when they do.
I don't think doom and gloom scenarios are helpful when we're trying to give people something to feel optimistic about. I also think that part of offering hope is helping people understand that there's actually something that they can do, that they can have control over, at times when perhaps they haven't had much of a sense of control.
Black community leaders will have much of the job of doing the convincing. Doctors may have the information, but not the trust.
The voice of community leaders can be extremely compelling and influential. As a public health leader, then what I take as my responsibility is to really be a good partner to the community leaders so that they have the information and resources to have conversations that might be much more welcome coming from them than coming from somebody like me as a doctor or a public health person.
When you read Dr. Martin Luther King Jr. and his Where Do We Go From Here, Chaos or Community, he speaks to the pillars of the Black community, the Black church, the Black press, Black fraternities and sororities, and Black professional organizations. So we're coming together to speak about our concern and to advocate for practices that close that health outcomes gap.
And then the medical system will have to come through with the vaccine. That means its distribution will have to be equitable and reflect the fact that COVID's hit the Black community harder than anywhere else.
We, as healthcare providers and public health systems, really have to put our so-called money where our mouth is. In other words, if we go through all of the most elegant, appropriate communication for people and have them ready for vaccination, and then it's not there for them, then we've created what I call another chapter responsible for mistrust. So along the way, what we really have to do is show people not just here's what you can do, but here's what you can go, here's what to expect, here's what will happen, and it's not just then one and done or two and done with two shots, but it's also we're here to keep answering your questions after the fact.
In other words, this isn't about building trust just for today, just for the vaccine. It's about rebuilding trust in medicine itself. You can find out more about all our guests on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
A good night's sleep means everything no matter where you are. Luckily, there's a CPAP machine for home and away. The Philips DreamStation Go offers the best of both worlds, a lightweight and discreet travel CPAP designed for everyday use that can be carried wherever you go. Dr. Mark Aloya is global lead for behavior change at Philips Healthcare.
Most people don't realize that missing just one night of CPAP therapy, which happens often when we travel for business or for pleasure, can put you right back to square one. Now there are more options than ever for CPAP therapy with the recent introduction of travel-sized CPAP devices like the Philips DreamStation Go.
Whether you're at home sleeping soundly or chasing a new adventure on the road, the Philips DreamStation Go is the everyday travel CPAP you want by your bedside. Find out more at philips.com/DreamStationGo. That's PHILIPS.com/DreamStationGo.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Nobody has the ethical right or the legal right to risk spreading a dangerous disease. It could cause death.
Why your workplace can fire you for refusing a COVID vaccine.
Then why we eat what we eat.
People who like a lot of sensation, and burning in your mouth is a lot of sensation, are more likely to be sensation seekers.
All that and more on Radio Health Journal.